Hi, hello. I am Dr. Aseshananda Dutta, cardiologist from Calcutta. Today, my discussion is regarding latest update in hypertension. So, in the introduction, I would like to say, as per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects almost 45% people in the age group of 40 to 70. Raised blood pressure is among the most important risk factors for cardiovascular death. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care people, and poor follow-up. In India, the prevalence has also gone up over 30 years from 29% to 38% in men and 28% to 32% in women. Despite that, nearly half of the people, or almost 51% of men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of the women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension worldwide. International Society of Hypertension, that is ISH, has released the ISH 2020 Global Hypertension Practice Guideline. Inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings. Optimal care refers to evidence-based standard of care, and where essential standards refer to minimum standards of care to allow specification of essential standards of care for low resource settings. The AHA and ACC has released a scientific statement in 2021 offering new guidance for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, there is no ASCVD or 10 years cardiovascular disease risk less than 10%. With stage 1 hypertension, that is blood pressure between 130 to 139 systolic and 80 to 89 diastolic, management starts with non-pharmacological therapy, that is non-medical medicine therapy, with lifestyle modification and other modifications. If blood pressure remains uncontrolled with lifestyle modification and prohibition of smoking or other alcohol or other addictions, with stress management, all these things. So if it is remained uncontrolled at 3 to 6 months, consider starting pharmacological therapy, that is starting medicine. Acute respiratory distress syndrome, or ARDS, we know these terms, very commonly used terms nowadays, is a potentially fatal condition involving lung damage, and experts often associated with severe COVID-19. A recent study which appears in the Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 millimeter mercury range substantially reduced cardiovascular adverse events in step randomized trial, affirming the sprint findings of an older Chinese population. Among 8,500 patients aged between 60 to 80 in China, the intensive target trimmed 26% of the composite cardiovascular risk. Findings from now a second major trial reporting a lower target could unite the guidelines, which even among US professional societies range from threshold of 130 to 150 millimeter mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommended that diagnosis of hypertension should not only be dependent on office BP measurement, but also on out-of-office measurements such as ambulatory blood pressure monitoring or home blood pressure monitoring. 24-hour and nighttime BP measurement were associated with greater risk of mortality and a composite of CV outcome. Thus, they may be considered as most relevant measurement for estimating cardiovascular risk. For every 20 by 10 millimeter mercury increment of BP measured at night, the risk of mortality increased by 23% and risk of cardiovascular event by 36%. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European guideline equally recommend 5 plus of anti-hypertensive drugs. Considering non-adherence treatment, The importance of combination therapy is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European guidelines recommend, especially in the context of lower BP target, to start antihypertensive therapy with an initial dual fixed dose combination of ACE inhibitor or ARB plus calcium channel blocker or diuretic. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is detection of a known carcinogen, namely NDMA, which can be found in candicertan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by WHO International Agency for Research on Cancer to be carcinogenic in humans. So if 1 lakh patient would have received NDMA contaminated valsartan from Xinhuai, the highest manufacturing site where the highest level of contaminants were found, every day for 6 years, in the highest dose, it could result in 22 additional liver cancer over the lifetime of this patient. The presence of NDMA in this drug could lead to 8 additional cancer cases in 1 lakh patients if they have taken the highest daily dose for over 4 years. Valsartan recall accompanied by a significant increase in rate of emergency department visit of almost additional 6%. The HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, nighttime therapy was associated with significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether the nighttime therapy, in comparison to usual upon awakening hypertension therapy, exerts a favorable cardiovascular risk reduction. The largest study included a total of 19,484 hypertensive patients. During an average follow-up of 6.3 years, 1,752 participants experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data and how BP differed during the sleep, resulting in relative risk reduction for cardiovascular event was significantly improved for nighttime treatment when compared with awakening treatment. Thank you all for patient hearing.